there's nothing that the orals can do that the injectables can't, with the exception of...
Warning!
You're watching Dr. Todd Lee TV, where theoretically you could learn a bunch of cool shit.
Hello, I am Dr. Todd Lee. I'm a medical doctor, IFBB pro bodybuilder, and biochemist. And I'd like to talk to you today about orals. This is the first time on the channel, this might be news to you, but the rest of you know that I don't like orals. I think orals are way abused by people. It's usually not even bodybuilders, it's biohackers and what's the proper term? Just people who lift and take steroids to get big but aren't actual bodybuilders. That the reason why they're popular is because people are afraid of needles, because you can swallow them. That's why they're called orals. And because they kick in fast for people who aren't patient enough to use proper injectable anabolic steroids. And of those people who are willing to do injectables aren't wise enough or knowledgeable enough to do loading doses. I have a video on loading doses that I shot a couple weeks ago. You go back and watch that if you want. But there are certain times when oral steroids are good. Now, why are they bad? Let's establish why knowledgeable, wise adult men don't use orals. The orals have a methyl group that's a carbon with 3 hydrogens bound to carbon 17 of the cholesterol backbone of a steroid molecule. Basically, there is a methyl group that prevents it from getting broken down in the liver. This causes liver dysfunction and liver health issues. You've heard that steroids are bad for your liver. This is really bad doctors who don't know what they're talking about, oversimplifying stuff to the point of it just being vastly inaccurate. That it's not that steroids are bad for your liver. Oral steroids are bad for your liver. That this will result in a number of problems, one of which is usually HDL suppression, which causes an LDL increase, which in the presence of high blood pressure and inflammation can result in atherosclerosis, which is what usually kills bodybuilders, is heart and or kidney disease, because as the blood pressure goes up, the kidneys start to take damage. As the kidneys are damaged, the blood pressure goes up. The more blood pressure, the more scarring, the more narrowing of the vessels due to plaque formation caused by the LDL cholesterol particles. It's a big downward spiral that results in death eventually. So to me, orals aren't worth it because they don't grow more muscle than injecting anabolic steroids. And as a bodybuilder, I believe that the point of steroids is to facilitate hypertrophy or muscle growth, and that you want to use the steroid that is the safest with the least amount of side effects, and then use the minimum dose that's necessary to get any growth. So like calories, you want to use the minimum amount of calories necessary to grow so that you don't gain excess body fat. With steroids, you want to use the minimum amount of milligrams to grow so you don't get excess side effects. So there are certain drugs that have the least side effects, and there are certain drugs that have the most side effects. And the category that has the most side effects are the orals. That usually, I don't want to say usually, there's trade-off, but it's unfortunate that people are, the least educated people are the most vocal in general. And that you've got the Dunning-Kruger effect, whereas people learn a little bit and they think they're experts, and then they go around and run their mouths about it. And so that's what most of the internet is. It's a bunch of incredibly stupid people who have no education and don't know what they're talking about, nor any appreciable credentials. They're not educated. They don't have muscles. They're not pro bodybuilders. Most of these steroid influencers, there's nothing special about them at all. But they will put up videos that you will click on, that it's all clickbait. It's based on SEO, search engine optimization. So they pick titles of videos that the audience is searching for, and they just put together a 9 to 15 minute video of shit because you'll watch it, and then that gets them views, and then they make money off of that or selling you their products. And I'm not saying there's something wrong with social media marketing or YouTube marketing. I'm just saying that it's backwards. Instead, the content should have some value and should be honest. And so I'm going to give you the honest truth that orals are pretty much useless for just about everyone. That instances when they're useful. Powerlifters. Powerlifters may benefit from the strength benefits of Anadrol or halotestin before a powerlifting meet. How much before a powerlifting meet? Not a long time. Maybe a couple days, maybe a week or two. That it's the metabolites of halotestin that are so androgenic, and those might take a little bit to build up in your system. So even though the half-life of the halotestin might be 4 to 9 hours, I don't remember off the top of my head, we don't know about the metabolites or how long they are. So it's trial and error when you have to put it in to get the maximum strength benefits. Powerlifting aside, would you use those drugs? A lot of bodybuilders use Anadrol in the off-season because it makes them bigger, but it makes them bigger due to water retention, due to deactivation of 11-beta-hydroxylase enzyme. So there's a shunting of the glucocorticoids to the mineralocorticoids, and so you end up having water retention. Usually the benefit of this is the water retention is more intramuscular and less extracellular. So kind of the opposite look of estrogen. So you end up, if you're eating clean, you would be big and hard. Now, I tried this to peak for a show recently, the Texas Pro, and it backfired horribly. So I don't see Anadrol as having any application for peaking based on my personal experience. Now, other people might have a difference of opinion. If you've had good experiences peaking with Anadrol, I guess, include in the comment section. And then I'm going to ask you some very specific questions to make sure that was the only variable. Because what I find is when people talk about their personal experience, they didn't isolate that variable. There's 6 or 7 things that are going on, and they just arbitrarily attribute what they experienced to the one thing that they want it to be from.
Greetings, Earthlings! Like, subscribe, and share this video. Share with a friend. Share with enemies. Share with people who think they know everything. I am a medical doctor, and I could be your doctor. Click the link in the description box. I can order you blood work. I can read the blood work. I can treat any illnesses. Basically, it's like an HRT clinic that's a one-man army. Also, I do coaching. Dr. Karina Dotson and I have a coaching business called Apex Coaching. So if you sign up with me, you get coaching, which is nutrition, programming, competition prep, or lifestyle coaching, as well as all the medical stuff. So you have 2 doctors in one business. It's going to be contest prep, the nutritionist, the programming person, and the doctor all in one. You can't beat it. It's integrated. It works the best that way. You'll love it. Make sure to do it. Click the link in the description box.
Now, Winstrol is very popular pre-contest. The reason why is people say it dries them out. And the reason why they say it dries them out is because it's an androgen, and the androgens compete with estrogens. Usually they've just got some bro science idiocy that they're talking about. Supposedly it causes an extra type of decrease in skin water, to put it mildly. My understanding is what makes Winstrol special is that it doesn't just block cortisol binding to the glucocorticoid receptor, it also stops cortisol from being released from the adrenal gland. And I believe there's another mechanism involved as well. And ultimately, this is supposed to make Winstrol the best drug for drying out. People say, oh, it causes my joints to hurt, and then it's from how dry it makes you. I think a lot of this is placebo, that they're really feeling that it could be just that their estrogen's lower, and that's why their joints hurt, because estrogen has a pain-killing effect, and it has a hydrating effect, an extracellular water effect, which is you're trying to get rid of that. So people are just putting the Winstrol in too early. If Winstrol's got like a 9-hour half-life, there's no reason to put it in before the week of the show. And these guys are putting it in 6 weeks out. A lot of what people do at the end of prep doesn't make any sense. That there's some application or some logic to having a strong androgen in at the end. But really, the logic would come down to if you're going to cut injections out simply so you don't get the inflammation at the site of the injection, because you'll get marked down if there's a lump in your skin from where you put a needle, that's when you would switch to an oral. And it makes sense to use the orals that don't aromatize, that don't convert to estrogen. The idea that you're using your orals as an anti-estrogen is just stupid, because you would either remove substrates to estrogen first, like testosterone, or you would take a drug that would be an aromatase inhibitor that is an anabolic, like Primo or EQ, or you would be using a direct breast cancer med aromatase inhibitor like letrozole or Arimidex. So if you're using Test and you're using a Arimidex or Primo to crush your estrogen, I don't see how adding Winstrol or Halotestin would also further crush your estrogen. Likewise, you could just remove Test and then your estrogen would get lower. The problem is people say, well, I need Test to stay full. It's like Test doesn't make you any fuller than the estrogen or aldosterone of the Test makes you full. So it's silly. It's like using MK677 and Ozempic. You're taking a drug to increase your appetite and you're taking a drug to decrease your appetite. Why not just don't take either drug? Like, that's the comments. Rather than taking, you're going to take Test so you're full, but you're going to take anti-estrogens and diuretics to get rid of water. The way that the Test makes you full is by having you hold water. That's what fullness is hydration of the muscle tissue. And some people are like, I don't know, man. It's just, I know I like the way I look on it, which now comes down to placebo effect, that people have an emotional attachment to certain drugs and they believe in the drugs the way that religious police people believe in their God. And so they think that things look better because they're on the drug. If you were to tell them, oh, it turns out that your drug's bunk, then they would think that they look worse. If, on the other hand, you told them, I'm going to give you a secret drug and this is what so-and-so used to win the Mr. Olympia, and they took that drug, they'd think they look better. All of this is in their head. It's all a placebo effect. And the proof is, if you've ever competed, you think you look fat and like shit most of your prep. Then you don't even look at your pictures after the show. 6 months later, when you actually do look fat and look like shit, you look at your pictures from your pre-contest and you're like, holy shit, I looked amazing. It's all relative. That's the bottom line. It's all relative. So in the end, the logic of using orals, non-aromatizing orals, is almost exclusively because you're about to step on stage and you're not using injections. There's nothing that the orals can do for you that injections can't. If you want to crush estrogen, you could use Primo. If you wanted something that was a DHT derivative, not that it works like DHT, but something that was non-aromatizing that doesn't crush estrogen, you could use Masteron, which is why most people do that. If you wanted something that had anti-estrogen receptor effects through the progesterone receptor, then that's why people might use Tren. But none of this is specific things. There's nothing that the orals can do that the injectables can't, with the exception of Halo converting to an ultra strong androgen and Winstrol preventing cortisol from being released from the adrenal gland. Maybe I'm wrong. If there's a specific drug that does something else, don't give me a rumor, don't give me your opinion, don't give me your bro science. If you don't have a study to back it up, don't even make the comment. But if you have some scientific proof that one of the other drugs stops cortisol from being released from the adrenal gland, then put it in the comment section. Otherwise, save it. As far as, and the reason why I'm not looking at the camera is because the light is so bright. I'm trying to use more light to disprove some myth. And once I conclude this experiment, I will then discuss the experiment. But I'm trying a different lighting to see whether other people's beliefs are false or not based off of the amount of light that I use. And I'm probably going to try different color shirts. I've never worn white before. And by not wearing a hat, by using a lot of light, and by wearing a white shirt, I'm trying to see how different the video actually looks post-process. So when are orals used, aside from peak week? Now, I'm not convinced it's even a good idea. I think what makes more sense after years of doing it this way is keep the injections in. You use maybe 50, maybe 100 milligrams of Winstrol, maybe 10, maybe 20 milligrams of halotestin. When I try to use 200 Winstrol and 50 Anadrol, I look like shit. Every day I stored 4 more pounds of subcutaneous water. I guess it was from liver failure, or if it was just from the Anadrol, I'm not sure. And I was super angry and miserable. I was a total dick. It was when 200 Winstrol makes you as much of a dick as like Halo does at 10 or 20 milligrams. So we're going to get to one of the other categories of orals. Dbol. Dbol is a special type of oral because it converts into methylestradiol. And normally you guys think estrogen's bad, and I understand you guys think estrogen's bad. However, if someone's really, really prone to hair loss and that they're very susceptible to DHT, and the only source of DHT is testosterone. It is not Masteron. It is not Primo. They're not DHT. They don't convert into DHT. They will never be DHT. The reason why you think that they're DHT is because what DHT is spelled out means is dihydrotestosterone. That rather than there being a double bond between carbons 4 and 5, that is a saturated bond. That instead of it being double bond, there's a hydrogen added to carbon 4 and a hydrogen added to carbon 5, and there's no double bond anymore. So it's dihydrotestosterone. But there's a methyl group added to position 1 in Primo and position 2 in Masteron that prevents them from being broken down inside the cell and allows them to be anabolic, whereas DHT is not anabolic. And because DHT is broken down inside the cell and the way it's shaped, it is very androgenic. It binds to the surface androgen receptor in the hair and the prostate and a few other places and causes a very robust effect. Because of the methyl group at position 1 and 2, Primo and Masteron do not bind strongly. They're not going to have the same effect. They don't have the androgenizing effect. So testosterone is way more androgenic than Primo or Mast because testosterone converts to DHT, and all of testosterone's androgenic effects pretty much come from DHT. So you can get around of all the side effects, the DHT side effects, by using something that doesn't convert to DHT, which would be Primo or Mast. The problem is Primo is an anti-estrogen, so it lowers the conversion of testosterone to estrogen. The only thing that's completely neutral that works as an anabolic that doesn't cause DHT side effects and doesn't cause estrogen side effects, that doesn't lower DHT, that doesn't lower estrogen, the only drug that does exactly what you want it to and nothing else is Masteron. Maybe there's another one out there. I don't know that there is. Possibly T-Bol. T-Bol is an oral that will work similar to Masteron and that it's purely anabolic. But because it's an oral, it's going to be liver toxic, whereas Masteron isn't. SuperDrol is oral Masteron, but SuperDrol does not work like Masteron. SuperDrol causes some severe liver damage, one of the worst for liver damage. That for some reason, methylating carbon-17 dramatically changes the effect of the drug. So Dbol is just EQ, which also doesn't convert to DHT. It's very mild. EQ is kind of like Masteron or Primo. It's more like Primo because EQ is an aromatase inhibitor. So it'll lower the estrogen in your body that's being made by testosterone. So one of the benefits, so what Dbol is it's a methylated EQ, only it works completely different because instead of being an aromatase inhibitor, Dbol will convert into methyl estrogen. So why is this good or bad? So methyl estrogen is a much longer acting form of estrogen than estradiol, which is what testosterone converts into. You need estrogen, specifically estrogen that came from testosterone. Why, no one knows, but it's got to be a testosterone that converts into estrogen to help convert GH into IGF-1. And IGF-1 is pretty much one of the main ways that you grow muscle. So it's silly to use GH if you're not using test. So using GH without a test base is kind of a waste of the GH, at least so far as the anabolic properties. GH has two properties, metabolic and anabolic. The anabolic properties come from IGF-1. The metabolic properties come from the GH molecule itself. So if you want to grow and you want anabolism, you should use GH, but only if you're also using test. Well, back before science really was, I don't want to say before science existed, but before we knew anything about this stuff, they used to do a Dbol and Deca cycle. And that was a way of putting on a ton of weight and water. And the thing is that Deca doesn't really convert strongly into estrogen, but it ends up indirectly causing your tolerance to the amount of estrogen in your body to go down. So you could have a low estrogen and have high estrogen symptoms if you use Deca. Dbol is a source of estrogen, and you need that estrogen for the GH-IGF-1 conversion. Estrogen is anabolic. It doesn't mean it's directly proportionally anabolic. It doesn't mean like the more estrogen, the better. There's a certain sweet spot where you get the maximum anabolic effect. And often that sweet spot is well past the point of tolerance. In other words, maybe you get estrogen side effects like Gyno at 50 estradiol, but maybe 80 is where you get the maximum benefits. And then anything over 80 is a waste. If you were to use nandrolone like Deca with estrogen, it might lower your tolerance from 50 to 30 or 20, depending on how much Deca you're using. So people used to use Deca and Dbol together before there was injectable test. And that the Dbol would, if they just used Deca alone, it would shut down natural test, your estrogen would go down, it'd be hard to grow. So if you added Dbol would be a substrate to become methylestradiol. And so now there's some estrogen in your body to go along with that Deca. Now, a smarter way of doing this, rather than adding methyl estrogen and then increasing your sensitivity, in other words, decreasing your tolerance to methyl estrogen, would be to use Primo. Primo would be a better choice with Dbol because Primo would lower your estrogen level. The conversion to methyl estrogen would be less, and so you get more out of it. Some people will say Ment is another option if you want to use injectable Ment. I don't have any personal experience with Ment, but Dbol is, and this is supposed to be an oral conversation, that is the rare instance when you'd want to use Dbol, is that if you need to provide estrogen to your system, but not DHT. So if test will cause you to lose your hair, and you don't want to fuck around with dutasteride, RU4886, topical dutasteride, you don't want to fuck around with any of the hair preservation methods, you don't want to get a hair transplant surgery, then you could simply stay away from using testosterone and use Dbol, but you'd want to use something that either lowers the estrogen so you can control it. So you have to find the perfect balance of Dbol and Primo to get the most out of your GH. Another way of doing this, if Primo is expensive, is using EQ, because again, EQ is an aromatase inhibitor. And there's people who won't listen to me. They'll think GHT bad, Primo is DHT, therefore Primo is bad. It's not true. Primo is not DHT, but there's people who will not unlearn that. So I'm saying use injectable EQ and oral EQ, which is Dbol. That way, the injectable EQ has an aromatase inhibitor that lowers the conversion of the oral EQ, the Dbol, from converting. So you could have an all Boldenone cycle. You have oral Boldenone and injectable Boldenone, and that would do everything except for provide you with DHT. And then some people are going to say, well, aren't you supposed to have a test base? If you're using a test base, you don't need the Dbol. I'm saying for people who refuse to use a test base, but still want the estrogen to get the GH conversion to IGF-1, this is the one time Dbol would make sense. Is 5 or 10 milligrams of Dbol a day to give you a normal HRT amount of estrogen. You're using the Dbol as hormone replacement therapy instead of testosterone. It's not TRT because it's not testosterone. You're not replacing testosterone with Dbol. You are, but then it's not testosterone replacement therapy anymore. Now it's just HRT. So someone might say, well, what if you used another DHT molecule? I'm like, okay, so this is where it gets even fuckier. You could use Anavar. And I know that doesn't make any sense. Anavar is kind of more androgenic than Primo or Masteron is. And people will tell you it isn't. Well, it is in a lot of people. And Anavar has a special property where if you take it under your tongue, it can spike in your bloodstream really fast and bypass the liver metabolism and go right to the muscles. So you could use Anavar to counterbalance the Dbol, but then at that point, why the fuck aren't you just using test? So in the end, no matter how you slice it, the most logical thing to do is always test and Masteron and GH. There will never be a situation where the most logical thing isn't test and Masteron and GH, except for if you're really prone to specific side effects of test and you can't use the test. But nobody's going to have an allergic reaction. I shouldn't say allergic reaction. No one's going to have an adverse reaction to Masteron who can tolerate other drugs because Masteron is the easiest to tolerate of all of them. There will be people who will say that they lose their hair on Masteron. I think these people are usually hypochondriacs and they're pulling at their hair. You remember the placebo effect we talked about a half an hour ago? There's something called a nocebo effect, where if you read about a side effect, you imagine the side effect until you have a psychosomatic reaction and that manifests. Because there's no scientific explanation as to why Masteron would cause more hair loss than Primo. In fact, it would be less because estrogen is hair protective and Primo is an anti-estrogen. So therefore, you're taking away from the protectant. That would mean more hair loss with Primo. The test and Primo should cause more hair loss than test and Masteron. And people will say, well, I added Masteron to a test cycle and my hair started falling out. I was like, but did you take away test? If you're on 200 milligrams of test and you add 500 milligrams of Masteron, you're still at 700 total milligrams. You're not taking away. It's not like you were on 500 tests and you're not losing your hair, and then you took away 200 tests and added in 200 Masteron, and then hair started falling out. That doesn't fucking happen. But the people telling you they lost their hair when they added Masteron, they don't explain it like that because they're too dumb to get that. They're too dumb to understand that that there's always going to be some androgenic effect to all anabolic steroids because they bind to the androgen receptor. So I'm not saying that Masteron can't cause hair loss. I'm saying there's no logical reason why it would cause more hair loss than any other anabolic steroid. And there are people who say, I don't know, man, I just get hair loss when I use Masteron. And I'm not saying that they didn't get hair loss when they used Masteron, but I'm sure if I really knew what was going on and they kept accurate records, there's a reason why they're losing their hair, and it isn't the Masteron's fault. There's something else going on. Like they added Masteron to a cycle without taking away from it. And it's the total load. That had they added anything, had they added EQ, had they added Tren, had they added Deca, had they added Primo, anything they added would have caused hair loss because it pushed them over the edge. Furthermore, have you ever heard of someone who is on a Anadrol-only cycle and had hair loss? Nope. Have you ever heard of someone who had an Anadrol-only cycle and then added Masteron and had hair loss? Nope. So we know that if there is hair loss, it's because it's Masteron plus test. It's the DHT that's causing the hair loss, not the Masteron. So The rare instance that Dbol is useful is if you are afraid to use test and you need an estrogen substrate. The rare instance that you would use Anavar in the off season, these are both off season, it is so that you could have some sublingual spike in anabolic and strength before the gym. It's still going to crush your HDL. It's still probably not worth it. The Dbol is still probably going to give you gyno, even if you think you can control it. Methyl estrogen seems to be a special type of motherfucker that I just strongly think if it's almost like you want to preempt the Dbol with Primo EQ to crush the potential of estrogen conversion and then slowly dial up the Dbol until you get the desired estradiol level. But if your nipples start getting sensitive or whatever, your blood pressure starts going up, you got to 86 that shit. Anadrol is great for bringing red blood cells up. Like if you've got a very low hematocrit or hemoglobin, like if you live in a village with lots of vampires and you're like a vegan and you won't eat any red meat, so you have no iron, then maybe using Anadrol would help prevent anemia. And so again, like you have to be in a disease state or be ill or have a genetic abnormality to where the side effects of the orals would actually be benefits. So as we're relying on the side effect of Dbol instead of using test, which is the appropriate drug, we'd be using a special property of Anavar is that it's got a biphasic distribution. There's a spike and then there's a normal tail. Taking advantage of that spike while you train, especially if you bypass the liver, it all gets sucked up in the muscle. There's nothing left to do anything nasty in your body. So I'm a big fan of that's one of the only orals I like is Anavar pre-lift. Dbol, this is a hypothetical situation. I don't really think it's appropriate. Anadrol, again, if you're that anemic and you're a vegan anemic, if you're anemic vegan or your boyfriend's a vampire or whatever the fuck, then I guess Anadrol might have an application. But in almost all other reasons why you use Anadrol, like strength, Anavar will do that too. Again, for the pre-contest phase, there's some limited application for Winstrol once you pull injectables. I just don't think it's wise to pull the injectables. As far as Halo is a lot more complicated because you're not really trying to take advantage of the Halo. You're trying to take advantage of the metabolites of the Halo, and we don't know what they are. So at that point, that's not enough. That's too much witchcraft for me. I'd rather use a drug we know what it does and how it works because the visual benefits aren't that great, and the psychiatric problems most people get from Halo are extreme. It's extreme problems. If you're someone who doesn't even like caffeine like me, because you don't like getting angrier, the last thing I need to be is angrier. The last thing I need to do is take drugs to make me angrier. That would be like if Lizzo took a drug to make her fatter. Like, what the fuck are you thinking? I would want to take a drug that makes me less angry, not a drug that makes me angrier. So I'm definitely not going to want to take Tren or Halo or Anadrol. Nothing that's going to stimulate me. The last thing I need is stimulation. So that's the answer. If you can think of another good use of orals, I am inviting you to offer your opinion in the comment section. I actually care what you think about what good uses of orals might be. All right, please like, subscribe, and share this. Battle Mead is ready for pre-order, and so is Wrath of the Valkyrie. We got a new and improved formula for Battle Mead. It's the same as the old formula, except I added in the super high quality carb source that's the cluster dextrin that is the top of the line. Nobody uses as much cluster dextrin as what I put in. I put in a new form of glycerol, brand name glycerol. I believe it's called Hydroprime. There's Glycer Pump and Hydroprime. One of them's in Fenner's Fury, the pre-workout, and one of them's in Battle Mead, the intra-workout. I also added EAAs. I put 11 grams of EAAs. So I added 30 more grams of active ingredients to Battle Mead per 2 scoops. So, like, basically, the serving size doubled of the product. Anyway, this has been an hour. I hope you had a good time. Thanks for watching. May the force be with you. I'd like to thank our sponsor, Fusion Regenerative Therapies, where I am the Director of Human Performance. This is the practice in which I practice medicine. We will be able to order you blood work and read your blood work and help you with therapy as needed based upon the results of your blood work. Please click the link to get a consult with me, and I can help you optimize your performance. Thank you.